Welcome back. Mr. Mansukh Mandaviya, the Union Health Minister, chaired a meeting with the health ministers of several states today, and the details of that meeting are now out. He reviewed the public health preparedness for the management of COVID-19 and also COVID-19 vaccination progress with state health ministers in view of the recent rise in cases globally. The states have been advised to be on alert and keep all the preparedness for COVID-19 management. And of course, he's talked about working in sync with each of the states and prioritizing testing, treatment, as well as vaccinations. Let me in fact go across to Rohit, who has more updates coming in from that meeting. Yes, Rohit, what was discussed between the Union Health Minister and the several state governments in that meeting?
Well, Siddharth, in fact, we have the advisory now that has been given to the states from the Health Secretary. So, in fact, here are some of the key pointers. Now, it says ensure effective compliance of the detailed operational guidelines for revised surveillance strategy. And remember, this is coming on the back and just ahead of the festive season. So, they mentioned that as well and said that all states must ensure monitoring and reporting of district-wise influenza-like illnesses and severe acute respiratory illnesses. This is another key point that has been given. Ensure adequate testing in all the districts as per COVID-19 testing guidelines. And a very important point here, ensure higher samples for whole genome sequencing amongst positive samples of COVID-19 in the community. Because remember, even in China now, the new variant that is behind the surge in COVID cases. So even here, they're emphasizing on sending samples for whole genome sequencing.
Okay.
Apart from that, they've also told to take stock of existing hospital capacities to see whether or not any of the hospital facilities or infrastructure needs to be revamped, the capacity needs to be revamped or upgraded. Apart from that, they're also speaking about keeping the focus on vaccination by creating community awareness. So these are some of the key points in this advisory from the Health Secretary to the states.
Absolutely. Thanks a lot for taking us through that. Let me take this across to Mohit Bhatt as well. Mohit, at the end of the day, this has got to be a collective effort between the centre and each of the states and union territories.
Well, yes, Siddharth, and the central government has made it clear that the state and the central government will have to work together to fight the menace of COVID-19. And the government has been saying this, that the COVID-19, the pandemic is not over. And today an important meeting was being chaired by Mansukh Mandaviya, the Union Health Minister, with all the state health ministers and the health ministers from the union territories. Now, in this particular meeting, it was being clearly said, and I would like to read from that particular guidelines and the report that has come after the meeting, that the central Union Health Ministry has asked states to be on alert and keep all preparedness for COVID-19 management. Now, the Mansukh Mandaviya has also told all the health ministers that centre and state need to work in a collaborative spirit, as we have done during previous surges. Test, track, treat, vaccinate, and adherence to COVID-appropriate behavior is to be done to remain vigilant. Now, we know for a fact that how Prime Minister Narendra Modi himself chaired a meeting, and he clearly stated that there has to be no complacency in terms of testing, in terms of the services that are being provided at various hospitals. And that is why on Tuesday we will have a mock drill all throughout the country in various hospitals. In Delhi also.
That's on the 27th, like you rightly said, ramping up medical infrastructure, testing, and also increasing the pace of vaccinations. That's the priority right now, as outlined by the Health Ministry.